1.
A nurse is caring for a client newly diagnosed with Guillain-Barré Syndrome. Which intervention should the nurse prioritize to ensure patient safety? Answer: monitor respiratory status and prepare for possible ventilatory support. Rationale: Guillain-Barré syndrome can lead to ascending paralysis, affecting respiratory muscles. Early identification of respiratory compromise is critical for timely intervention and airway protection.
2.
A nurse is caring for a client with increased intracranial pressure, ICP. Which nursing action is most appropriate to prevent further elevation of ICP? Answer: keep the head of the bed elevated at 30 degrees. Rationale: elevating the head of the bed promotes venous drainage from the brain, helping to reduce intracranial pressure. 3. The nurse is caring for a patient with a spinal cord injury at T6. Which action is the nurse's priority if the patient suddenly develops a severe headache and profuse sweating? Answer: assess for bladder distension and remove any noxious stimuli. Rationale: the patient may be experiencing autonomic dysreflexia, a medical emergency commonly triggered by bladder or bowel distension in individuals with spinal cord injuries above T6.
4.
A nurse is caring for a client post-craniotomy who is becoming increasingly agitated and confused. What is the nurse's initial priority action? Answer: check the client's neurological status and vital signs. Rationale: changes in mental status may indicate increased ICP or cerebral complications. Prompt assessment is essential for early detection and intervention.
5.
A client with a history of seizures is scheduled for discharge. Which discharge instruction is most critical to include? Answer: instruct the client to take antiepileptic medication at the same time daily. Rationale: consistency in taking antiepileptic medications is key to maintaining therapeutic levels and preventing seizures.
6.
A nurse is caring for a client with multiple sclerosis experiencing blurred vision and muscle weakness. Which intervention should the nurse implement first? Answer: initiate fall precautions and assist with ambulation. Rationale: blurred vision and muscle weakness increase the risk of falls, making safety the top priority.
7.
A client is admitted with bacterial meningitis. Which task should the nurse delegate to the unlicensed assistive personnel, UAP? Answer: provide oral fluids as tolerated. Rationale: delegation to UAP should involve non-invasive, routine tasks that do not require clinical judgment.
8.
A nurse is caring for a client with myasthenia gravis who reports difficulty swallowing. What is the nurse's best action? Answer: notify the healthcare provider and withhold oral intake. Rationale: difficulty swallowing may indicate a risk for aspiration. Withholding oral intake and notifying the provider prevents complications.
9.
A nurse is preparing to administer morning medications to a client with Parkinson's disease who is experiencing tremors. What should the nurse do? Answer: offer assistance to ensure the client takes medications safely. Rationale: tremors can interfere with self-administration of medications, increasing the risk of dropped or missed doses.
10.
A client with a traumatic brain injury is scheduled for physical therapy. The nurse notes the client is confused and has a fluctuating level of consciousness. What is the nurse's best response? Answer: cancel the therapy session and notify the healthcare provider. Rationale: a fluctuating level of consciousness suggests neurological deterioration, which should be assessed before proceeding with physical activity. 11. A client with a history of stroke is experiencing right-sided weakness. Which action is most appropriate for the nurse to take when assisting with transfers? Answer: place the wheelchair on the client's stronger side. Rationale: positioning the wheelchair on the stronger side facilitates safer transfers and promotes independence. 12. A nurse enters a client's room and finds them actively seizing. What is the nurse's first action? Answer: turn the client to their side and protect the head. Rationale: side-lying positioning helps maintain the airway and reduces the risk of aspiration during a seizure. 13. A client with increased ICP has a prescription for frequent neurological checks. Which assessment finding requires immediate intervention? Answer: a sudden drop in Glasgow Coma Scale, GCS, score. Rationale: A decreasing GCS score may indicate worsening neurological status, requiring immediate evaluation. 14. A nurse is caring for a client with Bell's palsy. Which instruction is most appropriate for the nurse to include in client teaching? Answer: use eye protection such as artificial tears and eye patches. Rationale: Bell's palsy can impair blinking, increasing the risk of corneal damage. Eye protection is essential. 15. A nurse is assigning tasks on a neurological unit. Which client is appropriate to assign to a licensed practical nurse, LPN? Answer: a client with stable multiple sclerosis who needs scheduled oral medication. Rationale: LPNs can administer routine medications to stable clients, consistent with their scope of practice. 16. A nurse is reviewing the care plan for a client with a new diagnosis of amyotrophic lateral sclerosis, ALS. What is the most appropriate nursing diagnosis to prioritize? Answer: ineffective airway clearance. Rationale: ALS leads to progressive muscle weakness, including respiratory muscles, placing the client at risk for respiratory compromise. 17. A nurse is caring for a client who had a stroke and now has expressive aphasia. What is the best nursing intervention to support communication? Answer: use simple yes/no questions and allow time for responses. Rationale: clients with expressive aphasia can often understand but have difficulty speaking. Structured questions help facilitate communication. 18. A nurse is caring for a client with suspected meningitis. What is the nurse's priority action upon admission? Answer: initiate droplet precautions immediately. Rationale: bacterial meningitis is highly contagious. Early implementation of droplet precautions protects staff and other clients. 19. A nurse is teaching the family of a client with Huntington's disease. What information is essential to include regarding disease progression? Answer: discuss the importance of advanced care planning and genetic counseling. Rationale: Huntington's is a progressive, inherited disorder. Early planning helps families prepare and make informed decisions.
20.
A nurse receives a report on 4 clients with neurological disorders. Which client should the nurse assess first?
1.
A client with stable multiple sclerosis.
2.
A client with Parkinson's disease awaiting physical therapy.
3.
A client with a seizure disorder reporting an aura.
4.
A client with a spinal cord injury requesting assistance repositioning. Answer: the client with a seizure disorder reporting an aura. Rationale: an aura can precede a seizure, and immediate intervention can prevent injury. This client is the highest priority. 21. A client with a recent stroke has left-sided hemiplegia. Which action should the nurse take to prevent complications related to immobility? Answer: reposition the client at least every 2 hours and use pressure-relieving devices. Rationale: frequent repositioning and pressure relief help prevent skin breakdown and complications of immobility in clients with hemiplegia.
22.
A nurse is teaching a client with a history of migraines about trigger management. Which recommendation is most appropriate? Answer: maintain a consistent sleep schedule and avoid skipped meals. Rationale: irregular sleep and missed meals are common migraine triggers. Lifestyle consistency can reduce frequency and severity. 23. A client with a head injury becomes increasingly drowsy and difficult to arouse. What should the nurse do first? Answer: notify the healthcare provider immediately. Rationale: deteriorating level of consciousness may indicate worsening intracranial pressure or bleeding and requires urgent medical evaluation. 24. A nurse is caring for a client with a cervical spine injury. Which equipment should be kept at the bedside to ensure safety? Answer: a manual resuscitation bag with a mask and suction equipment. Rationale: cervical spine injuries can impair respiratory function. Emergency airway management equipment must be readily available.
25.
A client is newly diagnosed with trigeminal neuralgia. What instruction should the nurse include to reduce the risk of triggering pain episodes? Answer: avoid cold drinks and minimize facial stimulation. Rationale: trigeminal neuralgia can be triggered by tactile or temperature stimuli. Avoiding these helps reduce pain episodes. 26. A nurse is providing care to a client with status epilepticus. What is the nurse's immediate priority? Answer: maintain a patent airway and administer prescribed anticonvulsants. Rationale: status epilepticus is a medical emergency. Maintaining the airway and stopping the seizure are critical. 27. A nurse is planning care for a client who has Alzheimer's disease and is at risk for wandering. What intervention is most appropriate? Answer: use door alarms and ensure the environment is secured. Rationale: clients with Alzheimer's disease may wander. Environmental modifications help ensure safety and prevent elopement. 28. A client who underwent lumbar puncture now reports a headache when sitting upright. What should the nurse do? Answer: instruct the client to lie flat and increase fluid intake. Rationale: post-lumbar puncture headache is often relieved by lying flat and hydrating, which help increase cerebrospinal fluid pressure. 29. A nurse is caring for a client with a brain tumor who reports worsening headache and blurred vision. What is the nurse's best response? Answer: perform a focused neurological assessment and notify the healthcare provider. Rationale: these symptoms may indicate increased intracranial pressure. Early detection and communication are essential. 30. A nurse observes a client with a spinal cord injury at C4 struggling to breathe. What is the nurse's priority intervention? Answer: call the rapid response team and prepare for intubation. Rationale: C4 level injuries can compromise diaphragmatic function. Airway and ventilation support are urgent priorities. 31. A nurse is caring for a client with amyotrophic lateral sclerosis, ALS. Which task is most appropriate to assign to the speech-language pathologist? Answer: evaluate the client's ability to swallow safely. Rationale: ALS affects bulbar muscles, increasing aspiration risk. A speech-language pathologist is qualified to assess swallowing. 32. A nurse is planning care for a client with advanced multiple sclerosis who is experiencing muscle spasticity. What nursing action is most appropriate? Answer: administer prescribed muscle relaxants and implement passive range of motion exercises. Rationale: muscle relaxants reduce spasticity and range of motion exercises prevent contractures and maintain joint mobility. 33. A nurse is assessing a client with a history of transient ischemic attacks, TIAs. Which finding requires immediate attention? Answer: sudden onset of slurred speech and facial drooping. Rationale: these are classic signs of an acute stroke, requiring immediate emergency evaluation and treatment. 34. A nurse receives report on a client with a ventriculoperitoneal, VP shunt. Which assessment findings should be reported immediately? Answer: bulging fontanelle and vomiting in an infant. Rationale: these signs indicate possible shunt malfunction or increased intracranial pressure, requiring urgent intervention. 35. A nurse is caring for a client with advanced Huntington's disease. Which interdisciplinary team member is most appropriate to help with nutritional needs? Answer: the dietitian. Rationale: clients with Huntington's often experience weight loss due to increased caloric needs and dysphagia. A dietitian can optimize nutrition. 36. A client with myasthenia gravis is being discharged. What instruction is essential to include in the teaching plan? Answer: take anticholinesterase medications 30 to 60 minutes before meals. Rationale: timing the medication helps improve muscle strength for chewing and swallowing, reducing aspiration risk. 37. A nurse is caring for a client with increased ICP who is receiving mannitol. What assessment is most important to monitor? Answer: monitor serum electrolytes and urine output. Rationale: mannitol is an osmotic diuretic that can cause fluid and electrolyte imbalances. Close monitoring is required to prevent complications. 38. A client with a traumatic brain injury is exhibiting decorticate posturing. What does this indicate to the nurse? Answer: there is damage to the cerebral cortex. Rationale: decorticate posturing suggests severe brain injury involving the cerebral cortex and requires urgent evaluation. 39. A nurse is caring for a client with meningitis who suddenly develops purpuric rash and hypotension. What is the nurse's first action? Answer: notify the healthcare provider and prepare for emergency treatment. Rationale: These are signs of meningococcal sepsis, a life-threatening emergency requiring immediate intervention.
40.
A nurse is prioritizing care for clients in the emergency department. Which neurological condition should be seen first?
1.
A client with Bell's palsy.
2. A client with a migraine. 3.
A client with head trauma and confusion.
4.
A client with chronic trigeminal neuralgia. Answer: the client with head trauma and confusion. Rationale: confusion following head trauma may indicate a serious brain injury or bleeding and requires immediate assessment.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!